quality assurance and the quality control, quality planning. We found some tools that we use. For example, in quality assurance, you can use like a fishbone identifying identify the root cause analysis. You can also make like a flow chart that also help to analyze the processes. We can use like matrix of decision when you are comparing, you want to take decision on different alternatives. You can use also other tools like brainstorming. Brainstorming, that's a method of where people can give some ideas on identified problem and come up with a definition. Can you hear me? I think. Are you following me? Okay. So we discussed also on some dimension where the quality healthcare, where you can find efficiency, effectiveness, on integrity, equity. Is also accessibility and the other dimensions. We talked about also the principles of quality, where we talked about the client systems and also so we are going to continue with the health information management or clinical system. That I'm doing the revision. That is not, I want to share the screen just now. It was a revision or a recap of what we have talked about the last time. So now we are going to finalize the last part about the quality assurance, where we talk about. So let us continue with the clinical information system or health information system. As a definition, the clinical data repository, when we see this, we are going to talk about health information management. As you know, currently we are using EMR, electronic medical records, and we are making, as far as technologies also come in, or where we are adopting the repository or CDR or clinical data warehouse, consolidated data from various. Okay, I was talking about the clinical data repository is a clinical data warehouse. We have these consolidated data from various clinical sources, such as electronic medical records, as laboratory system, provide a full picture of the care patients has received. Some example of the type of data found in clinical data repository include, that can include demographics, where you can find some the identifications of patients. This demographic information, they are like names, address, age, sex, or gender. You can find also other like level education, and those are part of demographics. Laboratory results, radiology images, admissions, transfers, and diagnosis. Genda mwamaze kugenda mukora amastage atandukanye, mwagiye mubona ko ahantu henshi bakoresha ama system open clinic, aho information zose z'umurwayi ziba bandikamo. Iyo rero, that is a clinical data repository that start. So the history yose imitindaho cyane, ariko nuko kera bakoreshaga icyo bita analog, ariko technology igenda izamuka, byagiye haza new drugs, new treatments, new tests, communication, satellite is almost instant communication, habaye advance mu bintu byinshi, na health sector rero nayo ntabwo yigeze isigara. Niyo mpamvu hajeho speed muri iyo technology. Data rero ni ikintu gikomeye cyangwa se information y'umurwayi bituma kumenya continuity of care akunda. Nubwo iyo system yagiye ijyaho ariko paper based system nayo yagiye itakaza imbaraga nubwo muri iyi minsi n'ubundi gihari. Mubona ko n'ubundi muragenda kwa muganga atwara ordonnance yanditse impapuro iki haraho ahantu hagiye hatandukanye biri paperless, buryo ibintu byose nta na kimwe gikoresha. Ariko amatransfers urugero umuntu agenda afite hard copy, ushobora kugenda akayita cyangwa se akanyagirwa. So turacyafite mu Rwanda percentage iri electronic ariko n'indi percentage kiri hard copies. Clinical information system rero iyo tuyivuze ni computer based this is a computer based system that is designed for collecting. Iyo tuvuze iyi clinical information system hazamo iyi system igizwe n'ibintu byinshi, harimo collecting, storing, manipulating and making available clinical information for healthcare delivery process. Ishobora kuba limited to a single area. For example, hari iyo ushobora kubona iri specific nko kuri laboratory gusa, iyo bazayita laboratory system, pharmacy system. Nk'ubu muri mugiye mu bitaro mubona ko uburyo bwa management y'imiti n'ama consumables biri specific, bifite iyo bita EMIS. Ariko wajya muri rusange mu mivurire za labo za clinical care of patients usanga biri muri open clinic cyangwa se izindi softwares that can be used for managing patient. So they may be widespread, including zabaye widely itari ifata umurwayi wese muri rusange. Icyo gihe bayita electronic, bayabaye electronic medical records that is specific muri department cyangwa muri unit. Provide a clinical data repository that stores clinical data such as patient's history of illness, interaction with care providers n'ibindi. Ushobora kwerekana data zose storing, managing data zose zirebana n'umurwayi, previous histories, the interaction also other care providers. Ibyo nabyo bishobora kugenda biboneka muri iyo health information systems. That also includes service functions such as the hospital information system. It can also be functional system like aid or scheduling. Muri gutanga amakuru rusange y'ibitaro cyangwa se hari nk'ikora gusa yenda tuvuge kubijyanye na appointments, kaba yari mindinga isaha ye agomba kuvurwaho, cyangwa se queue management abantu bagomba gukurikirana ku murongo. Izo zose zinjira muri wizana. Ushobora no kuba localized muri department nk'uko twabibonye na laboratory, cyangwa se nk'iya nababwiraga gukurikirana umurongo, order entry system, cyangwa se prescribing system. Uburyo umurwayi bamwandikira umuti hano aragenda yagera muri nibavuye kuri OPD yagera yenda agiye muri pharmacy runaka, bakinjira muri iyo system bakabona imiti umurwayi yaba yandikiwe. Ibyo byose ni one of clinical information system. So kubijyanye n'urwego rw'igihugu nuko health information technology target, stimulus target, dufite hospitals, tukagira some radiological radiology reports, tukagira some vital signs, tukagira insurers, the laboratory data, and also the report from the clinicians. National, ubundi cyiza nuko habaho a national wide network. Niyo mpamvu mwibonye how kigamijwe nuko by the future umurwayi hazabaho intercollaboration y'ibigo, uburyo umuntu niba yavuriwe mu bitaro bya Rwamagana akajya i Kanombe bidasaba kwirwa ajyana ibyo by'amatransfer n'ibiki byose, umuntu ushyiramo PID yiwe ageze i Kanombe bakabona amakuru yiwe yanye n'uburwayi bwe. Iyo ngiyo niyo bita national wide network n'aba-users n'aba health providers bose bashobora kuvura umurwayi. Can also health information technology improve health and healthcare. Of course, ibi nibyo twibaza, ariko kuri use yayo nuko icyambere improving care coordination and population public health, safety, efficiency, and reduce health disparities. It helps also to maintain privacy and security of patient health information and eliminate duplicate entries from a data administration point of view. Umva umurwayi hari igihe yazaga nko kuri OPD, outpatient department, ugashaka fishe ye ukayibura, file fishe ye n'uyibuze ugashakisha ahantu wazibitse ukahabura, yenda zimwe zaragize guteza igihe kirekire, izindi zikazimira kubera kukarasa ahantu hamwe haruzuye. Usanga umurwayi ikintu cya continuity of care kigorana, uburyo n'uburyo bw'ubuvuzi bugorana icyo gihe. Ubwo rero when there is this health information in organization, duplication of files also decreases, and it will be utilized to detect large population trends related to care, no kureba cyane cyane uko indwara zigenda zikurikirana n'abantu bagenda, uko status y'indwara muri community muri rusange yenda imeze, bigenda byoroha because of accessibility of analysis of data which are in the system that is easier and help to analyze as quick as possible the trends of the diseases. So there is stages. Stage 1 is data capture and sharing. Second one is advanced clinical process. Stage 3, that is an improved outcome that can happen. So these slides are a bit congested, but here there are some reasons that clinical information system is a high priority. We are focusing on patient safety and increased concerns related to safety and prescription of drugs. New emphasis on eliminating healthcare affiliate infections, demand for quality pay related to performance and outcomes, also cost containment in the face of increasing cost of healthcare, efficiency and effective healthcare delivery, that is a must this time, and also health surveillance. By defense and natural disasters increase the mandatory reporting requirements. Mwarabibonye mu bihe bya COVID, ntabwo twari kubona uko COVID kugira ngo ukore summarization y'igihugu cyose uhamagara ufite nka hard copy cyangwa urabanza gukora uhamagara umuntu ngo akohereze report, biba bigoye. Ariko niba ufite national wide system ku buryo abantu bose bayinjiramo nawe ubona ibiri kubera haba muri management cyangwa muri reporting, icyo gihe birakorohera gukurikirana surveillance n'ama maybe epidemics zishobora kuboneka, ukabasha kuzikurikirana neza on based on data received. Changes in the doctor's information gathering skills, accommodating aging and the mobile population, and also effective management of chronic diseases. Murabizi muri misi hari emergence of disease, NCDs, prevalence y'ama NCDs yagiye izamuka cyane, hypertension, cancers, those diabetes, uko zigenda zizamuka zikeneye management regular akenshi y'igihe kirekire, kugira rero umenye how the patient status is improving. Ugomba gutekereza ku kintu equal access to care and those and ensure the people knowledge sharing in healthcare and increasing importance of multiple users of data, translational medicine, movement from illness care to wellness care. That nowadays we are focusing much on prevention. Reason why, while you collect this information, will help you where to focus in prevention or promotion levels. Practice of medicine that is predictive, personalized, and preemptive, and changing the model for health cares, care system, and decreasing number for providers. Ikindi uko iyo murebye, always we say the health professionals are few. Niba dutegereza rero ko abastaff ari bakeya, tugomba no gutekereza how rationally to use them. This is why this clinical information system will help us to maximize our or to reduce the workload and also the time spent in different areas. So the current electronic medical record system or health information health records, they are fragmented patient records. We find that there is incomplete and unreliable data. Umurwayi uzareba usange records ze ntabwo ari records ziri integrated, usange zimwe ziri bitewe no subdivision abantu bafite, usange zitari kumwe, ahenshi usange ziri incomplete. Uzana system iraza mu bitaro ariko ugasanga kugira ngo abantu bayuzuze ni ikibazo. Code is unstructured location, data varies across records. Records namwe ugasanga byakomeje kujya mu gice kimwe sibyo bigiyemo. Poor user interfaces and inadequate data culture, usanga rimwe na rimwe uburyo bwo kuzishyiramo nabwo rimwe bugoye, bisaba yenda kwandika kandi wakagombye guselectinga wikomereza, cyangwa se ugasanga interfaces ntabwo nk'ibizamini bya labo umuntu uri muri consultation ntabwo ahita abibona, bisaba kujya guca mu zindi nzira kugira ngo abibone. Yama interfaces ahuza departments n'izindi ugasanga rimwe na rimwe ntibirimo. There is also passive participants in care process. This is also participant in the care process, they are not active. The data recorded after the fact. Ikindi akenshi ntabwo turikodingira amadata yacu ku gihe, usanga iminsi 2-3 naho ugiye gutangira gushyiramo information runaka n'umurwayi yarabaye discharged. The data storage also reflects a particular application and cannot easily be used independently. Ni ikibazo cya data storage, akenshi capacity yo storinga izo data ugasanga nta bushobozi dufite. Retrieval similar to paper records and retrieval similar to paper records, responsibility is on user to find critical data. Also the need remains hidden in the hide stacks. That's to say that uburyo bwo retrieving ariya amadata cyangwa se kuyakuramo bwagombye kuba ari uburyo buri summarized, buguha information ziri summarized bitewe n'ibyo ukeneye. Ariko usanga n'ubundi urabitrivinga ubikuramo muri iyo health information system ihari, asanga n'ubundi bivuyemo like ari nkaho bivuyemo n'ubundi like paper records, bigusaba n'ubundi igihe kinini cyo kubyarranginga. Also it gives us another issue. So it should ubundi yagombye rero kudufasha iki, must support multiple clinical domains and therapeutic areas, dufasha ahantu hose mu domains zose uburyo twakora no mu mivurire yacu. Contain embedded decision support, iradufasha muri decision making. Feed and screen superfluous data, present data appropriate for circumstances. zagombye kudufasha muri bwa buryo navugaga bwa summarization y'amadata. Niba ushaka amadata ajyanye na hypertension, ikayazana ari analyzed kandi ari well displayed, uburyo nawe yakorera interpretation ku buryo bworoshye. Support both push and pull data interchange. Ikindi naho uburyo bwo bwa collaboration cyangwa se interchange hagati y'amadata nabyo bikaza koroha. Department of cases. Provide data that is reusable. Yagombye nayo kuba itanga amadata yandi agomba kugenda akoreshwa kenshi bishoboka igihe biri ngombwa. Also needs behavior integrity, sound decisions, competence, workflow management, and provide, of course, privacy and security. It should be designed in a way that that give the privacy and security for the clients, and become a part of the patient care team, provided that give the advice supported by literature where appropriate. Ikindi nayo ikabasha gufasha abantu mu buryo bwo kubona amakuru ahagije cyangwa se information muri professional growth and patient care. And what we must have in healthcare settings, they are asking us if you want to install the healthcare system, the hospital need to have this. First one is should have architecture of MR. That staff will help to train and also to follow up the use and the management of for health MR. It requires independence of data from application. Data must be also interoperable and must be automatically usable, and must be capable of integration with new data, produce new value and understanding. Granularity of data must also start at low level, permit for effective computer analysis and understanding. They evaluate patient care and treatment as new data enters, incorporating all the data. I think this is clear, where if you want to install the electronic medical record at your facility, you have to follow this. Effective and timely disease management with a personalized approach. Knowledge also driven filters for presentation and exchange of data. Also must also be, you have to be proactive on recommendations of actions for both providers and patients. And you have to determine factors that impact health, clothing, social, economic, environmental situation, and you focus on reducing impact and negative factors. And have also to have an influence to influence the way providers practice medicine. So this is the end. It was an overview about health information management system. When you, I think it will be easier for you to use it and to customize, and also to ensure that even if you create your businesses, you'll be able to use the clinical information system within your institution. You can ask if you have a question. If you don't have a question, you can continue with entrepreneurship. To talk about introduction entrepreneurship, entrepreneurship is more investigating business ideas. Going to talk about small business decision, advantages and disadvantages of small business ownership. and evaluate the business opportunity, critical factors of success, source of idea for new ventures, screening the opportunities, and the researching opportunities in the sector. So, entrepreneur is a term that is used derived from French entreprendre, which means to go between or to undertake. This entrepreneur is a person who undertakes the risk of establishing and running a new enterprise. Please, if while I'm presenting, if you maybe you have a question, you have to raise your hand so that I can explain before continuing maybe on other slides without clarifying the previous one. Entrepreneurship is the process of creating something new with the value and of devoting the necessary time and effort, assuming the accompanying financial, psychic, and social risk, receiving the resulting rewards of monetary and personal satisfaction and independence. I think this is clear. If you are a good entrepreneur, you should create something new, which with value that you are going also to devote the time and effort by satisfying your personal independence. It is also different authors have been defined entrepreneurship, like William Gantner, who said that is a person who started a new business where there was no one before. Schumpeter also said that it is those are innovators who use the process of threatening the status quo and use the current assets of the existing products and services to set up new product or new service. This is an example where it's Mr. Schumpeter said that is an innovator where they use the processes by transforming the existing product to the new services, or new service, existing service to the new service. For example, making bags out of plastic bottles. That is an example of entrepreneur, according to Schumpeter. Peter Drucker said that entrepreneur searches for change, respond to it, and exploits opportunities. Mr. Zimara said that he defines entrepreneur as an innovator, also recognizing the sales opportunities, then convert opportunity to marketable ideas, add value through effort and skills. This is the relationship with Schumpeter and Zimara, where they say about innovation of the current product or service to the new one. The people that succeed are those who always reach for opportunities, and if they do not find them, they create them. This is according to Mr. Shaw. So we have also the term entrepreneurship. The entrepreneurship is simply as entrepreneurship within an organization or company. Entrepreneurs are entrepreneurs operating within the structure of a company. They are at the forefront of innovation and are given control of products and services that affect the company future growth. Entrepreneurship is essentially a mechanism within an organization setting that lets an employee act like that an entrepreneur. And these employees are given the tasks to create and develop new products. They are typically afforded much more leeway, support, and resources than other employees in the company. So we have some difference between entrepreneurship and intrapreneurship. Entrepreneurship is the practice of embarking a new business, reviving an existing business by pulling together a bunch of resources in order to exploit new found opportunities, whereas entrepreneurship is the practice of entrepreneurship by employees within an organization. An entrepreneur is an individual employed by an organization for remuneration, which is based on the financial success of the unit he is responsible for. Whereas the entrepreneur takes substantial risks in being the owner and the operator of business with expectations of financial profit and other rewards that the business may generate. There are many characteristics of entrepreneur behaviors: must take risks, curious, imaginative, and creativity. For risk taking, as you know, the business faces many risks. Entrepreneur minimize risks through research, planning, and skill development. And also is curious because entrepreneurs like to know how things work. They are taking time and initiative to pursue the unknown. And the imaginative and the creativity are creative because they imagine solutions to problems that encourage them to create a new product and generate ideas. Creativity is the ability to come up with something new, invent, find different ways, possible solution. Often they discover ways to turn roadblocks into opportunities. That is about definition of creativity. This ability to come up with something new, or inventing or finding different ways, possible solutions, and others. Other characteristics: entrepreneur also is persistent. The true entrepreneurs receive criticism and deal with money, family, or stress problems, but they still stick on to their dreams of seeing the venture succeed. The entrepreneur also is goal setter and hardworking. For goal setting, they are motivated by excitement of steering a new business. Once achieved, they seek out new goals or ventures to try. In hardworking, they need a great deal of energy to see a venture start and succeed goal. Is also self-confident because they believe in themselves. Their self-confidence, I think you are following me, and I think I'm not faster. Can you follow me, please? Okay, good. Thank you. Flexible. The flexibility must be there in order to adapt the change environment. This flexibility, for example, as you see, there are many changes in technologies, in the rules, amategeko ibintu birahinduka, economic environment igahinduka. A good entrepreneur should be flexible on that changes that happen. Barakubwira ngo koresha IBM, facture IBM. Wowe uti facture IBM sinayikoresha ahubwo akankomeze nkoresha yindi bandikisha imbaho. Ejo baza bakagufungira. So to adapt and be flexible on different technologies, have to be flexible. To adapt to changing markets. Ibiciro bigenda bihinduka, isoko rigahinduka. Have to be flexible on those changes. Independence. Entrepreneurs' desire for control and the ability to make decisions often makes be difficult for them work a controlled environment. Well, many of the characteristics and their behaviors, they are also independent. Abantu benshi baravuga ati ndambiwe gukorera abandi, nshaka akazi njya kwikorera nkajya nipangira iki, akora igihe nshaka nkataha igihe nshaka, nta muntu unshyiraho igitutu. That is a kind of independence. Ambition, a good entrepreneur also driven to make something for himself. He knows what they want and also he set a course of get it. Decision making, decision that entrepreneurs make that will determine also the rate of the company, and the entrepreneur will what decision making is his company state of inactivity in degradation. So dufite aba entrepreneurs benshi ari innovative who introduce new goods and new method of production, or discover new markets, new products, new ways, new markets in the organized enterprise. Imitative entrepreneur, this is the one who don't innovate. On this, they copy technology or techniques from others and also paste somewhere. Some of an example for some Chinese mobile phones, where we find in this group two subgroups, where Fabian entrepreneur, those are who are lazy and shy, who was guided by customs, religions, traditions, and past practices. They are skeptical in initiating any change. Also, the lack of desire to adopt new ways of doing things. Ahangaha murabona mufite bagendera ku mico, kuri religion cyangwa se ku zindi traditional practices cyangwa past practice, ku buryo badashobora guhindura ibintu byabo, bagendana n'igihe, ubwo bagendera kuri ziriya factors kenshi, abo babita Fabian entrepreneurs. Drone entrepreneurs, those are characterized by conservatism, do not bring change in their businesses as demanded by customer or technologies. Haba hahinduka iki, byagenda gute, nta kintu bashobora guhinduka, nubwo wabaha feedback, nubwo wagira ute, nta kintu bahindura. Those are drone entrepreneurs. So there are many functions of entrepreneur. We have production, sales and marketing, financial management, the technology, human resource management. There can be many functions in business or entrepreneurship. Also, there is a promotions, and also there also operation planning and the implementations. There is also production, financial management, and also there is policy making and the other leadership and management function that should be done by entrepreneur. Further, we can also make other categorization like skill-building, innovation, decision-making, management functions, and the organization function. So in the economy, in the society, you can have employment generation. Entrepreneurship also help, of course, by better standards of living, to help to create innovations in different areas. It It can also help on balancing balanced region development. It helps also in formation of capital and space of economic power. In a modern development, technology or a modern economic development, we have the aspect where entrepreneur coordinate the other factor of production, where this involves selection of right type of factors. There is employment of each factor in the right quantity and use of the best technical devices, division of labor, reduction of waste, etc. When also it takes risk where you have a risk which is insurable and the non-insurable risks. Mu marisk n'ubundi hari risk ziba ziri insured n'izindi ziba zitari insured, ariko izo zose arazifata as entrepreneur. Also the third also innovates, where we talked about previously. Innovation covers introduction of new good or new quality of good, introduction of new method of production, opening a new market, conquest of a new source of supply or raw material, carrying out of a new organization of any industry. The entrepreneurs fail because we have poor record keeping, lack of education in marketing and businesses. They don't have a written plan. They have maybe staff who is inexperienced. There's a poor quality of goods and services, poor customer services, and poor environment scanning. This is SWOT analysis, as we saw before, is used in the internal and the external evaluation to see the strengths, weakness, opportunities, and threats of the business. Other reasons, those are lack of experienced management, few trained or experienced human resource, poor financial management, a rapid growth. When there is a rapid growth also, sometimes management is very difficult. A lack of business linkage and weak market efforts, lack of information, the pricing or the cost of the activities also incorrect, improper also inventory control. There are some factors that can influence positively the entrepreneurship. That is, there's individual factors. For example, the motivation can influence you to do entrepreneurship. Desire to do something new, need for achievement, social status, education background, childhood and family environment, role models, and others. Can be an education environment. Though there exists a common perception that entrepreneurs are less educated than the general population, however, studies have found that entrepreneurs overall and female entrepreneurs in particular are far more educated than the general population. However, the education sometimes does not develop the specific skills needed in the venture. Nubwo some educations that are developing some skills, muri venture you need, but education also is very important. Children with the family environment. Children influence have been explored, particularly in terms of value, individuals' personality traits most frequently researched are the need for achievement, locus of control, risk-taking, and gender identity. Motivations. While motivation may vary, the reason cited most often for becoming entrepreneur independent is not wants to work for anyone else. Other motivating factors, that is, umuntu ageraho akumva ati njye nshaka kujya kwikorera, sinshaka kongera gukorera abandi nk'uko nabivugaga. These motivating factors differ from between men and female entrepreneurs. Money is also the second reason for men starting a venture. Job dissatisfaction, achievement, opportunity, and the money are the second other reasons for women. The motivation can differ from the gender, males and females, and also they have also other similarities which can push them to go for entrepreneurship. There is a role model and support system also as the factors. This is also the most influencing entrepreneurs in the careers choice as their role model. Can it be the parents, relatives, or successful entrepreneurs in the community? Ushobora kurebera kuri mugenzi wawe cyangwa se ababyeyi bawe cyangwa abaturanyi bo mwabanye cyangwa abantu bagiye basigira success muri entrepreneurship, kaba byakubera factor ituma nawe ujya. The role models can also serve as a supportive capacity, as mentors during and after the new venture is launched. There are environmental factors. This is political, economic, capital, and the others. As you know, our government, for example, in Rwanda, there are some funds allocated for the youth, and the female entrepreneurs, where they are a promotion of entrepreneurship by releasing funds to potential entrepreneurs. And economic. This is about the labor market, finance, if availability, for example, of raw materials, which can be accessible and it may be not expensive. Capital is one of the most important factors to establish enterprise. Availability of capital facilitates entrepreneur to bring together the land, machine, raw material, to combine them to produce goods. Labor, availability also quality labor can be also another factor. Raw material that's needed for establishing industrial activities without difficulties. Market, those are people ready to buy your product, and the nature of competition in that market. For example, if you have maybe near the school, if you find, for example, there's maybe where people we go for lunch, maybe the school is not preparing the food for the students, that is an opportunity for you to have the restaurant nearby that the students will use. Different needs should be assessed and checked for opportunity. There is social and cultural. The social system can either promote or inhibit development of entrepreneurial spirit by exhibiting values that either enhance or exhibit entrepreneurship behavior and drive amongst the people. Social mobility, the transition of individual from one. So I think here about the social mobility, maybe the individuals move from social stratum to another, either upward or down due to